We're here outside a remarkable medical facility here in Bakersfield, California, the Vascular and Leg Center, that proves to its patients every day you don't have to go anywhere else in California to get the most advanced medical care available anywhere. So let's go inside and meet the creator and founder of this facility, Dr. Kumar. What was your vision when you started this center here? It was so pioneering, so new, and how did you start it?
Well, 5 years ago, when I saw there is new technology available now to treat the patients with leg pain and leg swelling and patients with veins, arteries, gangrene, people are losing legs and getting amputations. And we saw this technology, we brought it to Bakersfield, and we are able to now open these small arteries going to the foot so that people don't lose their foot and they can still walk and they don't lose their legs.
Have you become a magnet in this field? In other words, are people coming to Bakersfield for this advanced treatment?
Well, you're right. Actually, we recently had a lady who came from all the way from Monterey. And when I saw her, I said, why you are here? She said, Stanford people told her that she needs amputation. That's the only thing. And when I saw her, I said, my God, we go to Stanford to learn what I'm going to do here. But when I saw her, within a few minutes, we said, well, we know what's going on. And we were able to treat her. The next day, she was walking. She never needed that amputation. That's, so people, you're right. People are coming from, I've seen patients from all the way from Monterey to Fresno to Los Angeles, San Bernardino. We see patients here now from all over California.
Well, Dr. Kumar, you're talking about family. I see a beautiful picture here. Tell us about your family.
Well, I'm blessed with a wonderful family. It's my wife, my two sons and my daughter. My daughter graduated from Harvard, and she is responsible for all the color schemes and all the different pictures and the paintings you see here.
What is this? This looks like Top Gun here.
Yes, you're right. This is Top Gun. This is the gentleman, Mr. O'Quinn. He's one of my patients who had a heart attack, and I fixed his artery, and he did great.
Here's this chart. All right, kind of explain to us what you're doing.
If you see this, our heart throws all the blood through these red tubes.
Right.
This is called aorta, and these are the arteries.
Right.
The arteries bring the oxygen and the nutrients to the tissues. Once they are taken up by the tissues, now all the toxins, carbon dioxide are thrown back into the blood. That's why we call it a bad blood, or venous blood, deoxygenated blood. Now this blood has to reach back to the heart to get purified again so that it can recirculate.
All right.
One good thing about the arteries, if they are blocked, actually, just like here, then there will be less oxygen and less blood going to the foot.
So our legs are just like our hearts.
That's right, exactly. If there's any blockage, like in the heart arteries, there is a heart attack. We go and put a stent there. Same way we are now putting stents into the arteries in the legs. Like here, you see that block is 99%. We were able to open this and put a stent here and open this artery.
Wow.
Okay. Now, once the blood goes down, the arteries bring it to the tissues, but the blood comes back to the heart through the veins, and these are the veins. And this is the network of the veins. If you see, there are two kinds of veins. One is the deep veins, and another is superficial veins. If the veins do not carry the blood back to the heart, or the gravity tries to pull it down, God created these one-way valves, and so that blood doesn't fall down. But if the valves don't function, the blood goes up and down, then the leg starts swelling and there's more pressure and there's a pigmentation or ulcers in these legs. And these legs, the people have Charlie horses, restless legs, pain, swelling. If that happens, we have the treatment available right here under one roof. If you see that there are three systems. One is the arteries, superficial veins, and the deep veins. That makes part of the circulation in the legs. Throughout California, if you see, there is no center that I know of, outpatient, that does all these three treatments under one roof. So we take care of the arteries, superficial veins, and the deep veins.
And I understand it can be done very quickly.
Absolutely, yes. Well,
that's amazing. Tell us about that.
See, average time that it takes for us to close a bad vein is less than 20 minutes. Okay?
Right here.
Right here, and patients can walk in and they walk out. They don't need a driver. They don't need anesthesia, no surgeries. They can walk from here. They can go back to work if
Does
they
it
want.
hurt?
Well, it does hurt a little bit, Poquito.
But it's done very quickly.
Yes, it can be.
That is really amazing.
Yes. Second thing I want to tell you is that you were asking me what do we do here special. We do something very special here for patients with kidney disease. If their kidneys don't function, then you know that dye or the contrast can damage their kidneys. And the kidneys, once they get damaged, the people need to go on dialysis.
Right.
We here at the center, this is the only place in Bakersfield, by the way, none of the hospitals, no other centers, we use a very special dye, we call it carbon dioxide gas. And that helps us to visualize these arteries and the veins. And so we don't need to use that much contrast. Okay? So this is something very special we are doing right here in Bakersfield.
I think one of the things you're doing, I've seen people that I've known have had diabetes. I've watched them first chop the foot and then chop the ankle and then chop up the rest of the leg. And it's one of the most horrible things I've ever seen. And you're putting an end to that.
That's right, Don. What happens, this is something exactly what you said. People, if they have a foot ulcer or wound or any sore point there, what happens is they first cut the toe, it doesn't heal, then the foot, it doesn't heal, then the leg, it doesn't heal, then above the knee. And you know why that happens is the underlying problem has to be understood. Diabetes leads to blockage in these arteries. And if you don't open the arteries, don't restore the circulation, now you have created a bigger wound by cutting the toe or by cutting the foot. How do you think it's going to heal? And so those areas don't heal because of the lack of the circulation. What we do here is restore the circulation, improve the circulation, and then let them cut the dead tissue or the toe or the foot so that it can heal. And that's how we prevent amputations.
Larry Mims is one of Dr. Kumar's many miracle patients.
I'm a pastor of a church, and a lot of things to do, and I was tired all the time. I wasn't being able to interact with my grandkids or study like I need to. And once Dr. Kumar evaluated my problem, I had a vein that was 100% closed in my chest and another one that was 90. And then I had a couple of closed veins in my, blocked veins in my legs. And the procedure that Dr. Kumar did for me caused me to get my life back. I'm like a 17-year-old, and I'm 73 years old, and I'm just full of vim, vigor, and vitality now.
You know, Dr. Kumar, I think what you're doing is miraculous. I mean, compared to what we've lived with in the past, what people have had to suffer in the past, they must just come here and think they've gone through a miracle.
Well, thank you very much, Don. I am blessed, and I have a wonderful team we have put together. We are about 9 providers now, and a staff of about 100 people. Okay, and all of us are at service of our people here.
Well, blessings on you, and it's just been a pleasure to talk with you.
Thank you very much. Thank you.